Hi, everybody. This is Joyce Briggs with the Ross Program. I'm with the Durham Housing Authority Resident Services Department, and I'm with the Ross Program, which stands for Residence Opportunity and Self-Sufficiency. And today I have a new becoming scientist, female scientist. I know you new guys didn't even know we exist, but Alicia Bass is a scientist and she is full of knowledge and she has personality and look at her, she's so pretty. Hi, Alicia.
Hello,
How are you
Joy.
today?
I'm well. How are you?
I didn't mean to make you blush, but I'm so impressed after having a conversation with you. And I want everyone to know all the things that you know too.
Thank
So
you.
tell us a little bit about yourself and your program.
Sure. So, as you mentioned, I am a scientist and I am based at FHI 360, and that stands for Family Health International. So, that is a global nonprofit. That means we work right down the street here in Durham. We also are in 90 countries all around the world. So,
Wow.
we mostly do health programs, but it's really about meeting community needs, trying to do the best that we can, and working with community, not just in community. I will also mention real quick, I do have a couple other titles if that's useful as well. So I am a professor of global health at the Duke Global Health Institute. And so I wear teacher hat part-time. And then I'm also an instructor at George Washington Milken Institute School of Public Health.
Oh, I'm so impressed. I am so impressed. So what have you been doing to stay so focused during all this pandemic?
I have been realistic with myself and taking breaks when I need to, but on top of that, I have been socially connected. You know, we talk a lot about social distancing. It's not really social distancing for me. I don't think that's how you manage something like a global pandemic. Physical distancing, that's
Mhm,
what the order is.
mhm.
But socially, I'm more connected than I have ever been. I talk to my mother every single day on video calls. I talk to my sisters every single day. I have a group text with my best friends, and we literally, the phone was going off earlier, so I didn't take it in here with me. So I think for me, social connectedness in the middle of physical distancing has been the way that I've managed. And then in terms of my work, community. So in that way, it's social connectedness too. The community is how my work has still moved forward. And as we've been translating things to virtual and online and doing the Zoom meetings, community support and partnerships is how that has been working as well.
That's great. So what news do you have to share with us today?
Sure, I got some stuff for you today, Joyce. Okay, so I'm here to share a little bit about a project that's going on right now. Is one project's finishing up, another one is starting. So I want to talk about both of them real quick. So
Okay.
let's start with the one that's finishing up. It is called the Adolescent Health Working Group. And that project is a partnership with Durham Housing Authority and many other community organizations as well. Now, a few years back, Durham Housing Authority and the University of North Carolina at Chapel Hill started a program called Project IFE. So folks in your audience might remember it. It was called Project I Feel Empowered. That's what IFE stands for. And it was really looking at the needs of older African American women living with HIV in the community. And what Project IFE told us was, we want you to focus on young people. They need help, they need support, they need resources. So this current Adolescent Health Working Group project is a direct outcome from Project IFE. So Durham Housing Authority, once again, was a major partner for us with this Adolescent Health Working Group project. And a lot of the Project IFE folks are a part of this project too.
Right.
So over the last year and a half, we had three things we were doing. We put together this working group with DHA, with UNC, with myself from FHI, with Healing with Care and people from the health department and Triangle Empowerment Center, you name it, we probably reached out in terms of community support for HIV prevention. That was the first thing. We also did surveys in the community with young people ages 13 to 24, and we also did interviews. And the point of all of it was to say, all right, Project IFE told us we need to talk to young people. Now let's do it. What are the needs of these young people? What questions do they have? So that is the project that's ongoing, and I can share some results with you, but that's that project that's wrapping up. It has now become another new project as well. So one of the things that I really took away moving to the Durham community just in the last year and a half is that there's a lot of young people around here that would love to do more research and want to be involved in research. It's just not something they get a lot of exposure to.
Right.
So I have a new project funded by the CDC, so the Centers for Disease Control and Prevention, and it is focused on young people ages 15 to 29 living in Durham who identify as African American or Black and identify as LGBT. Now, it's not exclusive to people who are LGBT, but that is a focus area. And we do a lot of wonderful things. We teach them all kinds of stuff. They came to conference with me last week. We do seminars. They are paid for everything they do with us, and it's a really community-based project. So I mentioned that as an opportunity for anyone who's interested. And I mentioned the other project because I want to share some results with you. And that project is something that was very much a community effort.
Awesome. Now, I remember when we had the IFE project and it was going so strong. And Linda, we used to bring condoms to my office. I used to work with seniors. Well, I always work with seniors. My office was at J.J. Henderson. And every couple of weeks, she would come and fill this jar with condoms. And that is when I found out that seniors are quite active sexually. So
Yes.
I'm like, oh, wow, okay.
Yes, yes.
And they
And
would
you're
come and say,
talking,
Miss Briggs, you don't have any more condoms. And I call them and say, Linda, bring me some more condoms. And then there she would be knocking on my door and even sometimes leave them in a bag for me right outside my office. So
you are saying
we
all the things.
appreciate, yeah,
So
we appreciate it. Yeah,
Linda Riggins is a part of our adolescent project and was a part of Project IFE. Shout
it's
out to Linda
amazing.
Riggins, y'all. She's everything. So your point is really well taken that a lot of times we don't talk as much about HIV, not in the community at all. Doesn't matter if we're talking about older people, doesn't matter if we're talking about young people. And we need that. We need to have more conversations about it. So Project IFE taught us that. And also the adolescent health work group, those meetings were held at J.J. Henderson as well. And so it was really a partnership with Durham Housing Authority and Mr. Cliff would prepare the lunch for us. He was so wonderful. So it's those same community partnerships that help us do the adolescent health study as well.
I appreciate that. Now, and the CDC has already started for you?
Yes, ma'am. So we are wrapping up the Adolescent Health Project. The CDC project started last October. And so what we do is we meet every couple of weeks with young people. And like I said, sometimes they'll come to conferences with me. They'll come to meetings with me. We'll have training sessions depending on things they want to learn. And they direct the activities. I promise you, it's not the other way around. It's not me telling them what we're going to do. I try to listen and then do what they say. And so we make sure these young people have a voice and they decide everything that we do. We also make sure they are paid for their time. We will not be asking young people to work free in the community because it's not fair. It's not equitable.
That's awesome. That is so awesome.
So that's our other project that it started recently.
And are you looking for more young people to take part of this?
Yes, absolutely. So if people are interested or they have questions or they have someone they think and they have in mind that might be interested, I would love to follow up and give them more information.
Okay. Well, if you send me a flyer, I'll make sure it gets out into the community if you haven't already done that. Though
I will do that.
I may be
Thank
behind.
you.
Okay, that'll be fine. Anything else that you want to tell us?
Yes, I want to share some of those results with you from the Adolescent Health Working Group project. So that's the one that's finishing up. And the first thing I want to share with you is that the only reason we got to finish that study was the community. So I said that we had these meetings where we would bring together community members and organizations. And I said we did those surveys and I said we did interviews.
Right.
I want to tell you about the strength of community in doing those things. Before COVID hit, we had 4 in-person meetings. We had to have our last 2, the final 2, virtually. And Miss Joyce, I got to call you Miss Joyce. We had wonderful participation, even after being in that virtual setting. Awesome. So we still had our young people come out. We still had our partners, including DHA, including Tammy Jacobs and Linda Riggins and everybody on these virtual Zoom sessions. So we were able to do what we said we were going to do because people were still willing to be involved.
Awesome.
The second thing I mentioned was the surveys, right? So we said we were going to conduct surveys with 100 youth in the community ages 13 to 24 and just ask them, have you ever been tested for HIV? Have you heard about it? Where did you hear from? Etc. We got to 87 out of 100 surveys.
That is so good.
Yes, and that is because we had community support. We would reach out to partners, they would send the flyer, they would send people to us, they would ask us questions to support us. There's no way we would have gotten those numbers without our community partners and support. And the third thing I want to share is that we said we were going to do 15 interviews. We got to 13 out of 15 interviews because we had community support.
Awesome. I applaud you.
Oh, thank you. Thank DHA. Thank Tammy, everybody who has been so supportive since the days of Project Ife. And I guess the other thing to share is some of the things we learned from that work. So I told you the numbers, but we definitely learned some things as well. So one thing we learned is that young people need to drive the process. They are not just the participants in the study. They are the study. So the way they think about things, the questions that they have, what they want to see us do, that's the most important stuff that we could possibly focus on. And we need to make more space for that. The second thing that we learned is that in order to do that, there has to be protected space that's just young people only. Because, you know, in the African-American community, we are taught to respect our elders. When you have young people and adults in the same room, those young people are not going to speak first. It's a culture thing. It's a matter of respect. So that means they got to have those youth only rooms. That's why we have to have youth researchers and young people that are willing to help lead those conversations with their peers.
And they're so smart these days too.
They know more than me, that's for sure. And so I think the third thing that we really learned is even though youth have to drive the process is not just about youth. When we would have our working group meetings, we got so many questions from adults as well that did not know as much about HIV, and it just because they're adults doesn't mean they know more about it. And to your point, we have older adults in the room. They need the condoms and the information on preventing HIV as well. It's not just young people that need that support. And even with things like HIV prevention medication, there is a pill you can take every single day, once a day, to protect you against HIV if you are exposed to it. And it came out almost 10 years ago, and nobody in the room had ever heard about it. So some people know it as PrEP, which stands for pre-exposure prophylaxis. It also has brand names if you've ever heard of Truvada or Descovy, things like that. But when we were in that room, it was not just the young people who had never heard of such a thing. And so that really spoke to us and said the whole community needs resources, they need education, they need information. And those are the things we've learned so far, even before I come back and share more results with you. Those are some real key takeaways for us.
And knowledge is power. Knowledge is power.
Absolutely, absolutely.
That is so good.
Thank you.
So anything else before I get your contact information on my board?
No, I think I've alluded that I'm going to come back and share some more information with you.
Oh, yes, please. You just let me know.
I will. I definitely will. I think for us, Durham Housing Authority has just been such a wonderful partner, and it really speaks to partnerships in the community. And I just want to say a thank you, to Tammy Jacobs, to Melvin, to everybody who's been involved with this project directly or indirectly. And even the suggestion to come on the podcast today, that's the strength of our partnerships in Durham Housing Authority. So I appreciate you all so much for that. That's it, Joyce. That's all I wanted to share.
Okay, and so if anyone would like to sign up for the CDC project, how would they reach you?
So I will send you a blurb, but I'm going to tell you on my phone number right now, and you can call me directly and talk to me. So it's a Florida area code, everybody. Don't be worried. It's area code 954-736-6772. When you call, I will answer.
And at the end of this video, you'll see a board with all of her contact information on it. And we do appreciate you giving us your time today. It was so nice meeting you.
You as well,
This is-
Joyce. Thank you for
And
your
I've seen
time.
you before because I've seen, I don't know where, but I've seen you before. And it's so good seeing you again.
You
And
as
thank you
well.
so much for your time.
Thank you.
And thank you, audience, for joining us. Don't forget to like the video, share the video, and subscribe. Have a good Friday. Bye-bye.
You too. Bye.